Good day. Thank you for joining me today for another edition of Under the Cupola, a program that we in Weston do to kind of talk to the people who are really key decision makers and folks that really help make Weston a really great and special place. My name is Leon Gaumond, and I have the honor and pleasure of serving as the town manager for the town of Weston. And here today I am joined with Kelly Pawluczonek, who is our new health director for the town of Weston. Hi,
Hey,
Kelly.
Leon, thank
you.
you.
For coming. Yes, appreciate it. So you just recently started here in Weston.
Yep, it's been about a year and a half.
Okay, it seems like only yesterday that you joined us, and of course you came in during a really interesting time. You came in during the COVID pandemic.
Yep, and the Delta variant beefed up, and then we had Omicron, and we're still fighting the battle.
Good. Well, not good that you have to fight the battle, but at least it's good that we have some good people working in the office to help us all with that. So tell us a little bit about yourself and what made you come to work for the town of Weston.
Sure. Well, my name's Kelly Pawluczonek. I received my undergrad degree from Framingham State in biology, and then I went on to receive my master's in emergency management. I got trained up, became a registered sanitarian, certified pool operator, certified pool inspector, soil evaluator, system inspector, lead determinator. There's a credential out there. I've probably obtained it. I sit on the executive board for the Public Health Emergency Preparedness Coalition, and I've worked in several communities in Massachusetts, and I'll be celebrating 19 years in public health this April.
So congratulations.
Cheers to that. To be honest, coming to Weston wasn't in my game plan. I was working for two communities at the time, one full-time, one part-time, doing a little bit of double duty. And I had got a phone call from the previous director, and we had a conversation, and it seemed like it'd be a good fit. I did some community research, and population-wise from the communities that I was working with, it just seemed like the right decision. So I went from health agent to health director, so it was a good career path that made sense to me.
Well, good. Well, we're happy to have you here, and we're happy to have stolen you away from your other communities.
They're still mad.
So tell me, what made you think of public health as a career in the first place? Is this something you always wanted to do?
No. I took one environmental engineering class in middle school, and I really thought I wanted to do environmental engineering with ecology, save the planet. Did a couple internships with some environmental consulting firms, saving the piping plovers, a couple internships with the New England Aquarium. And I really wasn't looking towards public health, but I was offered a position in a community, and I got the best of both worlds here. I get my environmental side, and I get the nursing aspect, because, I was still in college, 9/11, and then you had Katrina, and that's kind of what brought me to my emergency management path. And here, again, I get the best of both worlds. I get my field work with septics and soils and construction and demo, and then I also get my nursing-related opportunities running vaccination clinics and immunizations. So,
yeah. Well, it's certainly been keeping folks in the public health field busy the last couple of years.
Oh, 100%.
Yeah, great. Tell us a little bit about the Weston Health Department. What do you have for employees? What kinds of services do you provide?
Sure. So we have a 3-member board, very passionate. We have myself, the health director, a full-time health agent, the administrative assistant who's full-time, a part-time public health nurse. And then we've recently contracted with some regional services. And right now that gives us the opportunity for additional nursing services and an additional health inspector and a full-time epidemiologist that's doing some work.
So well, that's great because, not to cut you off, but it seems like by doing that, we can have access to different kinds of services without having to bear the full cost associated with those services.
It's very helpful. Right now we're working on joining up with Impact Melanoma to get some free sunscreen dispensers. So we're in that process. I'm hoping to put that maybe by some trails, maybe some parks, and the dispenser will be free and we'll just fill up with the sunscreen. That's part of the regional services grant that we're looking forward to. Some of the outreach programs we're doing right now would be immunization clinics. We're still putting out COVID-19 vaccine boosters. We just finished up our flu season vaccination. You know, there's more to come with the regional grants. We want to do some mental health first training and just reach out. We're going to talk about Lyme disease, again, sun protection, but it's all coming down the pipeline that we're looking forward to creating those.
And you work for the Board of Health, essentially, the Board of
Correct.
Health, who's an elected board here in Weston, and they kind of give you your, your priorities and the things that they would like to see go forward, correct?
Correct, yes.
Yeah. And you are the director, and so your staff really works for you, and you direct them on a daily basis.
Yep.
And what are some of the programs that people might come to you for?
So,
Other than vaccinations?
well, a lot of the things that we do on a day-to-day is what we're regulated to do. So when you want to have new windows, do demolition, do something with your septic system, you're coming to our office. You want to open a food establishment, you're coming to me for licensing. You want to do pool, a camp, you have a complaint, you have a nuisance, you're coming through my department. And I'm either going to tell you what to do, what you need to do, and permit you to do such. So that's a lot of our day-to-day stuff. Again, we do the immunizations. You know, we're hoping in the future to offer, say, pneumonia or Shigella. Still trying to work out the cost effectiveness of, can we offer that, get reimbursed? So still working on some of the programs.
Tell me about the Medical Reserve Corps, because I know
Yes.
you also have involvement with those folks.
We do. We have a very passionate group of Western Emergency Reserve Corps volunteers, and we do a lot of outreach, kind of tabletop type things where we would go to an event, set up a table and give out information. We also work on our response plans for any disaster in town. So knock on wood, you know, anything that kind of wiped out a portion of town, whether it be a microburst, we would be sheltering in place.
Yep, yeah. So you kind of practice with those volunteers.
We do.
Yeah.
We do.
If somebody was interested in joining the Medical Reserve Corps, how could they get involved?
Sure. So there's different avenues and different levels of volunteering. If you wanted to, say, just do Weston, you can sign up to be a Weston Emergency Response Reserve Corps member, and that application's right on the website, or you can come get it and see me. Or if you wanted to maybe expand and go to another town or somewhere else in the state, you would sign up through Mass Response. You know, I personally got sent to Springfield right after the tornadoes, and was shelter manager for a day or two, which was interesting.
Yes, I lived in Springfield at the time, so I know all about it. Yeah. Tell me about what the goals are for your upcoming year. What things are you and your staff working on for the upcoming year?
Sure. So right now we're trying to get online permitting so people can submit everything online, pay online, much like the building department has. Again, we're talking about outreach programs that impact melanoma to prevent sun cancer and, you know, skin cancer screenings. Mental health first training is, you know, one of ours. Again, the vaccinations. And we're going to adopt and work on our DNA and lab regulations. We're looking forward to updating some of the septic regulations that are a little outdated.
So updating regulations is always a good thing, particularly as the science changes. But the biolab that we are going to be seeing come into the town in the next year or so, we're going to, you know, there is some response that the town has an opportunity to participate in that process, so that, you know, there is some oversight of some degree of what's going to happen there, and that falls under you and this committee, correct?
Correct.
And if somebody was interested in the work of that committee, they could outreach to you on that?
100%.
Oh, great. So the last few years have been really trying. You know, when I got started in you know, municipal life, we had things like avian bird flu, for example, and we had, you know, the 9/11, which showed great tragedy and how public health really needs to be more of a player in the seat, having a seat at the table. And then we had the pandemic, and nothing could have thrust, public health into the spotlight more than the pandemic. What are you thinking, and what are you hearing in the world about what the next generation of public health is going to look like? What are the things that you feel are going to be, critical skills for the next 20 years that they might have to look to revamp public health in Massachusetts?
Well, one thing we saw with the pandemic, and especially the vaccine rollout, was we were originally doing everything on paper. So if you wanted a vaccine, you were showing up, you were filling out the paper, and you were hoping that there was going to be something for you. What changed is everything got online. So we first started using PrepMod. You were registering through PrepMod, you were coming in, we would sign you in. So it basically went from paper to PrepMod, and then we started using color.
Right.
So everything's kind of getting advanced from paper, all electronic, which makes it very easy for you, easy for me, and very much easy to get reimbursed for those vaccines.
And easy for people to track.
Correct.
Yeah.
Correct. So some of the things I see going forward, especially after the pandemic, is some of the shortfalls that were being lost in public health. It's always, what more can we do? We're doing what we need to do as an enforcement and a regulatory agency, but what else can we do? Are we going to start looking at mental health? Yep, we're going to look at that. We're going to look at health equity when it comes to our response. How can we get, if Kelly doesn't have transportation, how can we get her vaccinated? Making everything on an equal playing field for everybody. Coming down the line, because there's money coming into public health, because we went through this pandemic, we're going to be talking about, age-friendly populations. We're going to be talking about, is racism a public health issue? Is gun safety a public health issue? Everything that's coming down the line can be considered a public health issue. And I think after the pandemic, there's going to be money coming into public health for us to manage.
It always seems that once we have a real disaster, that the federal government and the state government come forward with funds
Yep.
to help fill the gaps.
Correct.
And I remember after 9/11, they deemed public health to be an area where significant resources were not there.
Yep.
In a lot of, and I'm sure many of the people who are watching this at home probably don't realize, is that in a lot of other parts of the country, public health isn't done on the local level. It's done on a county-wide level,
Correct.
for example. And so you have a county health department. Here in Massachusetts, we are the forefathers of public health as an entity. And, the history that we have here in Massachusetts is that every city and town kind of directs its own public health with certain governing rules and regulations that the state and the feds, provide, mostly the state. But at the end of the day, it gives great authority to local boards of health, local communities, to kind of set their own parameters and their own directives on how to deal with public health. And so it doesn't surprise me that resources are being directed towards these entities like yourself.
I agree.
And sharing of resources, like you were talking about, the regionalization effort, allows us to benefit from, how do I put it, resources that we wouldn't use on a daily basis, but would be there in case we needed them. So I really commend you and the Board of Health for being thoughtful about approaching this and how you are going to implement this here in the greater Weston area. What are the communities involved in that regional health?
Sure, there's 7 of us. So there is Wayland, Sudbury, Concord, Carlisle, Lincoln, Bedford, and Weston.
Yeah, great. A lot of peer communities to Weston we compare ourselves to on a regular basis.
Yep, and we're sharing information, and it's been extremely helpful. And even though that's a work in progress, we're getting there. We're getting to where we want it to be. So even with flyers that we're going to starting to create, it's working. So
you and I have one thing in common, and that is, as public servants, we basically are here every single day to help the public. We help them with all of their problems and all of their questions and all of their concerns. So, to the people who are watching, what are some of the things that you feel it would be great for them to know about the Board of Health, the health department, what you do, and what are some of the frequently asked questions that you get asked all the time?
Where's my septic system?
And if I came into your
Yes.
office and gave you my address, you'd be able to tell me?
If I have it on file, which I would say 90% of the time we do, depending on the age of your system, we can provide that plan for you. So if you needed to have your septic tank pumped, we can provide you that location that you would give to your pumper or your septic hauler. If you needed to add, say, pool house, we can give you that septic plan so you can meet the proper setbacks. We're seeing a lot of that right now. Yeah. So we have your septic plan on file, most likely. Yeah.
Great. Anything else that you'd like to add?
No, I think that's it. I mean, a lot of the questions that we get is, why do I need to have an asbestos check if I'm doing construction, renovation, or demolition? And it's because there's no timeline for asbestos like there is lead. So even if your house was built in 2015, you might have asbestos products.
Yeah.
So you got to do it.
So you have a pretty close working relationship with the building and land use departments at Town Hall, working hand in hand.
Yes.
Yeah.
We are emailing and chatting all day.
Yeah.
So a lot of it's, hey, I'm all set with this. I've received everything that I need. And they'll call back and be like, hey, did so-and-so apply? And I go, nope, give me their email or contact information. I can reach out and tell them what they need. I think just today we've probably had 6 phone calls like that.
Wow.
So,
You know, public health has a really large umbrella. And you touched it twice on a subject that has become something of importance, not only in Weston, but in public health generally, and that is mental health.
mm-hmm.
And there have been resources coming to communities for mental health services as well. Tell me how you folks approach mental health issues here in town. And it could be anything from, you know, just people in crisis or even things like hoarding. I mean, we have all kinds of those issues, you know, even in Weston.
We do. A lot of the times I'm very lucky because I can reach out to Kate O'Donnell at the police department, who is the crisis intervention officer. I can reach out to the COA who has two social workers on their staff, and we tend to work together. Even the veterans agent, you know, we worked on a case with a veteran in town that needed assistance. So a lot of times I'm branching out to other entities, and sometimes it could be Springwell, who, you know, works with elder affairs and can kind of get the help. When it comes to hoarding, it can be, again, my responsibility. I'm a regulatory authority. If you call me and say somebody's a hoarder, I have to legally conduct an inspection, and I might be sending out an enforcement order on that hoarder. It's not going to be overnight, though. This is a mental health issue. This could go on for years, and I'm going to be buddy-buddy with everybody, but I'm going to do it legally.
Yeah.
So.
Well, thank you very much for joining me today. It was a pleasure. I hope that you have a long and happy career here in Weston and enjoy your time and your service to the community.
Thank you. So far, so good.
Oh, good. And in conclusion, I just want to thank you all again for joining me for the latest episode of Under the Cupola, and we will see you next time when we all gather under the cupola. Thank you.